I would just like to start by asking, do you give verbal permission to participate as a model in this assessment assignment and be recorded for school purposes for Aspen University class N495?
Yes.
Okay. This assessment is intended to show my skills with the assessment actions only and is not to be used as direction for your health status or follow up with any irregular findings. Do you understand this?
Yes.
Okay, thank you. Hello, my name is LaShondra Watson, and I'm going to be filming my head-to-toe assessment today. At this time, I have washed my hands, greeted the patient, I have gotten height, weight, vital signs, and I've already done the visual check on the Snellen chart, and the patient is 2020. So at this time, I'm going to ask, sir, if you could state your name.
Kelton.
Okay, and what is your date of birth?
12/23/1971.
Okay, and could you tell me what day it is?
October 28th, 2019.
Okay, so the patient is neurological, alert and oriented. So next I'm going to do a skin assessment. So, okay. All right, so skin appears to be intact. I'm looking, there's no rashes or lesions or open areas present. I'm going to check your feet. And there, okay, skin is intact. No open wounds or lesions on that side. Skin is intact there, no open wounds or lesions there. Okay. And so next I will be doing the capillary refill. So I'm going to check the capillary refill here. That's great. Less than 2 seconds on each finger. And then so next I'm going to be checking, I already checked, as I said, the feet for the edema. And let's see here, gotta take that back off. No swelling or edema present there. All right. No swelling or edema present to the foot area. Okay, and then so next I'm going to be doing my head assessment. Take a look at your skull. Here, hair is thick and throughout, evenly dispersed, and I don't see any open cuts or lesions or any rashes or discoloration. And now I'm going to just check your sinuses. I'm doing your frontal and maxillary. Any pain?
No.
Okay. All right, I'm going to ask you to lift your neck, and I'm just checking underneath there. And now I'm going to check for your lymph nodes. So this is just, I'm checking the head area and making sure everything is okay. And now I'm going to do the lymph nodes, and I'm going to start with the pre-auricular, auricular, occipital, submandibular, submandibular. And I'm checking to make sure I don't feel any lumps or anything, any pain when I do that, when I touch here.
No.
Okay. And then thyroid, I'm looking there, and I'm just checking to see if everything is there, if the trachea is midline, and I'm checking the clavicle, and any tenderness or soreness here
No.
when I check. Okay. All right. So at this time, I'm going to give you this cup of water here. You put it in your mouth, but don't swallow until I tell you to. And this is where I check for the trachea alignment also as well in the thyroid. So if you go ahead and you swallow, okay, it's even and it stays midline. So that is the thyroid glands and the lymph nodes are intact. So now I'm going to be checking the eyes. I'm going to be doing the neurological exam. And the first thing I'm going to check is for cranial nerve number 2, which is checking for peripheral vision. So what I want you to do is just to look right at my nose and let me know when you see my line, when you see my fingers come into your vision.
Yes. Yes. Yes.
Okay, cranial nerve number 2 is intact. So now I'm going to check for cranial nerve number 3, number 4, and number 5, which is going to be checking for extraocular movement. Okay? Don't move your head or anything, just follow my finger, okay? Okay, so the extraocular is intact, so that means that cranial nerve number 3, 4, and 5, cranial nerve number 3, 4, and 6 are intact. Because what I'm looking for is to see like if there's any extraocular movement as I move my fingers along. So next I'll be checking cranial nerve number 5, which is sensory. And with that, I want you to close your eyes and tell me when you feel the touch.
Yes. 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 Yes.
Okay, so therefore we see that cranial nerve number 5, sensory, is intact. So now I'm going to do cranial nerve number 8, which is facial. So what I'm going to ask you to do is lift your eyebrows for me, okay? Smile for me, frown for me, pooch out your cheeks. Okay, there you have it. Cranial nerve number 8 is intact. So next I'm going to check for cranial nerve number 9 and 10. I'm going to take this tongue suppressant, and I'm going to ask you to stick out your tongue. And what I mainly want to see is that there is a rise in the extra membrane in the back, and that the uvula stays center, and that there is a gag reflex present. Stick your tongue out for me. Okay, cranial nerve number 9 and 10 are intact. There is a positive gag reflex. So next I'm going to check cranial nerve number 11 for facial and shoulder strength. So what I'm going to do is I'm going to take this hand and try not to let me push your face. Okay. All right. I'm going to push down on your shoulders. Okay. So there we see that cranial nerve number 11 is intact. So next I'm going to check for cranial nerve number 12. So I'm going to ask you to stick out your tongue, wiggle your tongue from side to side. Okay, the patient is able to do that, so cranial nerve number 12 is in place, is intact. Next, I'm going to check for cranial nerve number 1. Close your eyes and tell me what you smell. Okay, therefore cranial nerve number 1 is intact. So now I'm going to do a visual check. I'm going to check the eyes itself. So what I'm doing is I'm looking at the sclera, and it's white, and on this side there's white, and the conjunctiva, they're both pink. And also, like I said previously, I checked the vision on the Snellen chart, and the patient is 20/20 vision. Okay, next I'm going to do Perla. So I'm going to use this pen light, and I'm going to check the pupils. So on this side, the pupil is estimated to be about a 3. On this side is estimated to be about a 3. They're both equal, and they're both round, and they accommodate to light. Okay, so Perla is intact. Next, I'm going to do cranial nerve number 8, which is checking for hearing. What I'm going to do is, I'm going to whisper to you, and you tell me what I said, okay?
1, 2, 3.
Okay.
4, 5, 6.
Okay, so there we have it. Hearing cranial nerve number 8 is intact. So next, I am going to do the audioscope, which I'm sorry to say I do not have an audioscope present. So normally I would want to examine, if I did have one present, both ears. I would take the audioscope and I would look inside, and I would be looking for it to be like a pearly temporal membrane, shiny with a little cerumen present. I wouldn't want any liquid to be in there because that could be indicative of an infection. So that is how I would perform my audioscope exam if I had one present. Also, next I'm going to do the nose. So what I would ask for you to do, Kelton, is if you could pinch off one nasal layer and then blow through the other. Okay, and let's repeat on the next. Okay, thank you. So there, what I'm checking for is patency. And also, I can use my pen light since I don't have that equipment, and I would just check inside and make sure that the membranes are nice and pink. There's no drainage coming from the nasal area. And then now, what I'm going to do is I'm going to ask him to open his mouth. I'm going to check his mouth. What I'm looking for, I'm looking at the lips. Then I'm looking at the mucosa, and making sure it's nice and pink. And then also I'm checking the gums. And if you can stick out your tongue, I'm checking that as well, make sure it's nice and pink. And that there are no open lesions or wounds or anything going inside the oral cavity. So from checking the oral cavity, then what I'm going to check now is the chest. I'm going to look at the spine, and I see as he sits upright, the spine is in alignment. Nothing's crooked or out of place. And I'm going to percuss the lung. Okay, nothing abnormal heard. So at this time, I'm going to check for tactile foramini. And what I'm going to do is every time I touch you, Kelton, I want you to say 99.
99. 99. 99.
Okay. Now I'm going to auscultate and listen to the lung sounds. Okay, breathe deep for me, in and out. Out. In. Out. In. Out. In. Out. In. Out. In. Out. Okay. Posteriorly, the lungs are clear. So now I'm going to check from the front. And what I'm going to do is I'm going to percuss the frontal lobes. Okay. Now, I'm also going to check here for tactile foramini. Close your eyes, and when you feel me touch you, say 99.
99. 99. 99.
Okay. At this time, I'm going to auscultate the lungs. Okay. In and out for me. Okay. In and out. Okay. Oops. In and out. 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 Okay. All right, the lungs appear to be clear. No crackles, no wheezes, or anything. Lungs are clear and patent. Now at this time, I'm going to check the cardiovascular system. So what I'm going to do is I'm going to check first I'm going to look at his neck, and I'm going to look to see if there's any jugular vein distension present. And also I'm going to check the carotid arteries. Okay, no breweries heard, so everything should be fine. And now I'm going to check my heart sounds. Okay, S1. I'm sorry. This is aortic, pulmonary, tricuspid, and mitral. And again, I'm going to listen to it with the other sound. Aortic, pulmonary, tricuspid, mitral. Okay, Kelton, if I can have you lay back. Now I'm going to check your bowel sounds. And I'm checking all 4 quadrants. Vowel sounds are present in all 4 quadrants, and I also hear clicks and gurgles. Now I'm just going to check for renal. Okay. And then at this time, I'm going to palpate the percuss the abdomen, and I'm just checking to, well, actually, no, at this time, I want to palpate the abdomen. Can you just let me know, do you feel any pain or anything?
No.
Okay. So over here, I'm going to check, I'm going to be checking the liver and the spleen, and what you would want to do is start at McBurney's point, and you start over from the left, and work over to the right. And I'm asking at this time if the patient feels any tenderness.
No.
No tenderness? Okay. And then we'll also take over the abdomen, and just start over to the left, I'm sorry, to the left. There we go. Do you feel anything?
No.
Okay. So you start here over to the left, which is McBurney's point, and you feel over. And make sure there's no tenderness or distension. Okay. All right, now at this time, we check for that. The abdomen is okay, doesn't seem to be any tenderness, or it doesn't look abnormal. It's a nice, normal sized abdomen. So at this time, I'm gonna have you sit up. And I'm gonna, at this time, check the deep tendon reflexes. I'm gonna be checking the biceps, triceps, and the knees and ankles. Okay. All right. Ready? Okay. Oh, okay, that's fine. Okay. All right. Here, I'm gonna check your ankles. Push it out for me. Okay. Lift up for me. Okay. All right, so I've checked for that, and now I'm going to be checking for the Babinski, which therefore I'm going to look at the ankles and make sure that there is no sores or anything, no diabetic neuropathy in place here. Looks good, looks normal. Okay, nothing present there. So at this time, I'm going to check the pulses. I'm going to check your radial pulse, your dorsalis pedis. That's not here. I mean, not dorsalis pedis, I'm sorry. This is the dorsalis pedis here. On the foot. And it is, let me check it on both sides. About a 2+ on each side. This is your posterior tibial, and I'm checking for. And I'm trying to make sure that all the pulses are not thready, they're even, not bounding, and not weak. And this is about a 2+ as well. 2+ on the posterior tibial. Okay, now at this time, I'm going to ask you to close your eyes and hold out your arms. And let me know when you feel something sharp and when you feel something dull. Close your eyes. Tell me what you feel.
Sharp.
Tell me what you feel.
Sharp.
Okay.
Nose. Nose.
Okay. So, as we can see, the deep tendon reflexes and the Babinski is intact. So now I'm going to check for coordination. I'm going to ask him to close his eyes. Don't close them yet. Let me tell you what to do. And then what I want you to do with your eyes closed is touch your nose like that. And then if you can, just speed it up a little bit more. Okay. Now a little bit faster. Okay. That's good. Great. You can stop. And then now I'm going to have you to tell me, I'm going to place an object in your hand and you tell me what the object is, okay? Close your eyes for me.
Coin.
Okay. I'm going to place it in this hand and you tell me what it is.
Pin.
Okay, very good. Okay, next I'm going to do the muscular exam, and I'm going to have you lay back at this time. And I'm going to have you bend your leg, and then what I want you to do is just move your leg, hold it down a little bit, and move it from side to side. Okay, all right. Okay, side to side. Okay, great. So now, the next thing I think I'm going to have you sit up for me. And stand up for me. This is where we're going to check your coordination. We're still checking further your musculoskeletal coordination. So, if you could please stand on one leg for me. Very good. Now stand on the other leg. Very good. Okay. So at this time, I'm going to have you hold your hands up. And then toss it again. And I'm just going to look like this. Okay. I'm checking both arms are equal. The strength is equal in both arms. He's able to stand on one leg at a time. So balance is good. So then at this time, I'm going to have you walk towards the door. Okay. If you can walk that way. And I'm assessing his gait at this time and making sure he's steady. He's not wobbling. And then I'm going to have you come back now. And if you could, please come back heel to toe. Okay. Great. All right, turn around. And then at this time, I'm going to have you go back on your toes. Okay? And at this time, come back to me on your heels. Okay? Now bend over. And let me look at your spine. Spine is intact. Good alignment there. Okay, and at this time, this completes my exam. Do you have any questions for me, Mr. Kelton?
No.
Okay.